Good morning, all. Hey, Kelly. Hi, Michelle. Hey, Sarah. Margaret. All right. As folks pop in, it's great to see everyone. Welcome to the Child Outcomes Accountability Team meeting. This is one of our Vermont Early Childhood Action Plan committees. It's great to see everyone. So I'm Beth Truzansky. I'm the Deputy Director at BBF. And today we are focusing our meeting on kind of different trauma-informed family connection frameworks that are used across the state as kind of an activity to both learn about what's going on, but also to monitor the strategic plan and to see how we're doing. So wanted to start. So we're going to give a quick overview of this part of where this work is outlined in the strategic plan. And then we kind of have a panel of folks who are sharing a few different frameworks and approaches that are used across the state, and then we'll move into discussion, have some small groups, and then large group discussion. That's our plan for today. How's that sound? Good. Awesome. All right. So Kate, if you want to pull up the slides, and I need to move. Okay. Great. So we are focusing today on goal 2 of the VECAP is, you want to move to the next slide. There we go. Families and communities play a leading role in children's well-being. Many folks are familiar with this part of the strategic plan. And then under that, so really focusing on that kind of parent or caregiver-child connection and how do we promote that. Next slide. So within the strategic plan, objective 2.1 is support parents and caregivers to build connection and capacity to serve as their child's first and most important teacher. So we're talking about kind of building capacity to promote health and well-being, fostering secure attachment, social emotional development training, supporting parent partnership collaboration, et cetera. And then goal objective 2.2 is to promote child, family, and community resilience, connection, and belonging. And so within that, we're talking about cultivating resilience, investing in prevention, expanding, the value of home visiting and trauma-informed practices, getting embedded in early care and education programs. So that's your 2-cent tour to where this is in our kind of 5-year strategic plan. And so we can dive into kind of, all right, so how are we doing that? What's going well? What can we learn from different strategies? Let's see, Kate, is there another slide or do we want to pull that? Oh, right. So the 4 different kind of frameworks that we are going to explore today and are around Touchpoints. Rachel Wallace-Broder from VCHIP is going to talk about Touchpoints. We are going to hear about Strong Families Home Visiting, and Anna McGuire, who's a CIS director, is going to be talking about that. In the Northeast Kingdom. Nurturing Parents, we have Michelle from Prevent Child Abuse talking about nurturing parents and strengthening families. Michelle will also talk about strengthening families. And then we will have space for others to share kind of what else you are using, whether you're in Head Start or other programs. CIS Strong Families, yes, of course. So that's our plan for today. So with that, I'm gonna are we going in this, Kate, do we want to go in the same order that things are listed?
Sure, that sounds good.
Okay.
If Rachel's up for going first.
Okay. And
Thanks.
remind me of remind everyone of the time frame that folks have for sharing.
So I think 5 to 10 minutes would be great. 5 maybe presentation, and then maybe a little wiggle room for questions.
Sounds good. All right, Rachel, you're up. Sorry. Hi, everyone. Thank you for inviting me here today to talk about Touchpoints. My name is Rachel Wallace-Broder. Thank you, Beth, for pronouncing it correctly. I am a project director at the Vermont Child Health Improvement Program, and I work in early childhood systems. So my work is primarily with supporting Dulce and medical practices, as well as Touchpoints, which is what I'll be talking about today. So why Touchpoints? Because when we strengthen families, we ultimately strengthen the community. So this is a quote from T. Barry Brazelton, who is the pediatrician who developed this Touchpoint model. And we really wanted to promote Touchpoints among early childhood professionals in Vermont, because we saw it as an opportunity to have a common language and framework to really anchor our work with families, to strengthen those early relationships, and as it says here, ultimately our communities. Just want to set the frame here that all development occurs in the context of a relationship, and Touchpoints really is about supporting that relationship. So the Touchpoints approach is a way of providing care to families by really understanding early development. And this model is 0 birth to 6 years. And supporting relationships. So it was developed by the pediatrician, Dr. T. Barry Brazelton. He's shown here in this picture. It is evidence-based and preventive approach to family and child engagements that really supports professionals in forming strength-based relationships with families around their child's development. So the Touchpoints approach is grounded in and built upon systems theory. So Touchpoints recognizes that the child and family are part of a system, and that really any change or behavior in any part of the system affects the rest of the system. So we're really looking at the whole family system together when we're looking at Touchpoints. It is culturally responsive, so we know that parenting is nested in a broader system of relationships that are shaped and impacted by cultures. And Touchpoints really offers a means to join the family system of care and discover their culture rather than insisting that they join our culture. And reflective practice. So Touchpoints is a framework that can be used to reflect on our practice with families, children, and colleagues. And reflecting on it really supports our learning process and is a self-care strategy for professionals. So there are 2 foundational components of Touchpoints. There is a relational framework and the developmental framework. So the relational framework is really specific strategies that are called guiding principles and parental assumptions that are about building relationship with parents. The principles and assumptions are used by professionals to guide their engagement practices with parents. And in doing so, providers and parents kind of come together to support the child's healthy growth and development and engage in strength-based parent empowering activities from which relationship enhancing attitudes and behaviors emerge. The principles and assumptions really serve as a foundation for improving professional relationships and building strong systems of care. The developmental framework is really about understanding the process of early childhood development to help families identify and expect the normal bursts and regressions in children's behavior. And when parents can identify these periods of disorganization or predictable
temporary regression as normal, they're able to see the child's behavior in a new light, which really helps contribute to reciprocal understanding between professionals and parents in support of that child's early learning and success. So this just shows kind of the path of Touchpoints Informed Practice. So we're offering the trainings on Touchpoints Informed Practice. So that's where participants are learning the knowledge and skills, practicing it both as part of the training and then in their work with families, which ultimately leads to improved provider-family relationships, increased family competence and confidence and in their parenting skills, and improved child developmental progress. So the benefits of Touchpoints are many. Here are some. So when we look at families, it really reduces parenting stress. It increases parental confidence and competence. It increases knowledge of infant and child developmental process and improves parent-child interactions and relationships. For providers, it increases knowledge of infant, child, and family development process. There's a reduction in child behaviors that adults find challenging and really supports positive attitudes about families and family engagement. And then for organizations, we see an increase in staff retention, improved organizational climate, better staff well-being, and improved relationship among staff. So we started the Vermont Touchpoint Center at VECAP in 2022. We have had, I think we're on our 10th training perhaps. We have so far trained 140 or 149 people have completed or are currently enrolled in a Touchpoint training. We have 2 that are on active right now, or more than 2 that are active right now. You can see from this slide, we've had folks trained from basically every county in Vermont and across multiple sectors. And our trainings are all cross-sector. And we hear that's kind of one of the things that folks like best about training. And here's a quote from one of the participants, which really captures a theme from many participants, that they like the collaboration with other participants and gaining an understanding of touch points from other views and varying professional roles. So we have folks from healthcare and early childhood education, family support. It's been wonderful. Children's Integrated Services has really adopted this approach and really supported training of their folks in this. So we see this as a way of really breaking down those silos across the early childhood sector, and again, providing that common language and framework for the different folks who are working with children and families. Here's some evaluation data. We assess for each training, this kind of summarizes all of it, that pre and post change in knowledge. So we look at change in developmental knowledge from prior to after the training, changes in relational knowledge, and then total knowledge is a combination of both of those. But you can see increases in all of those, particularly in the developmental knowledge. And then really, when we ask folks how useful do they find the training for improving their practice in various aspects, these are just few of them. So vast majority report was very useful for their understanding of child development and child social and emotional development. Really useful for their ability to talk with families if their child has developmental concerns. Helpful for their ability to work with families from different cultural and language backgrounds, and with relationships with other providers in their area. And then I just wanted to share some voices from Touchpoints Informed practitioners, so folks who have completed the training and the reflective practice portion of our training. I'll just read a few of these. So building relationships is what this training confirmed even more for me. When working with colleagues, children, and families without a relationship that is built on trust and understanding, the work is that much harder. That really encapsulates the Touchpoint approach, which really is about collaborating with families through that relationship. We hear a lot of folks Touchpoints really helping them slowing down to actively listen instead of just crossing things off our list. We know that professionals have a lot to do when they're interacting with families, and this provides an opportunity for them to really slow down and be with the families instead of focus on the tasks they're trying to achieve. I use Touchpoints constantly, even in non-professional settings. It seems like such a natural guiding tool for interactions with parents and families. Touchpoints has given me a base to start working towards stronger relationships with the families or children in my care. And then I love this one. The great thing about Touchpoints is that it can be applied to my work every single day. I come back to the Touchpoints principles and use the challenging moments as an opportunity to connect and dig deeper. I think overall, Touchpoints helps us to be more patient, curious, empathic, and grounded. So in summary, this is kind of our Vermont Touchpoints creed. Touchpoints is a way early childhood professionals engage in relationship with families, joining their system of care with a lens that identifies strengths to help them build their capacity to parent in response to their child, even in the face of difficulties. Touchpoints helps professionals understand that they do not need to have all the answers, that they are bringing their expertise, partnering with families, and learning about the family's expertise to create shared meaning about who this child is, how they learn, and what they need to develop optimally. And I was very excited to see some of our team here. We have some of our Touchpoints facilitators on the call. I saw Janet Kilburn and Julie Kulowitz. For more information, you can contact myself, Michelle Rovnak, who helps coordinate all this work, and then VECAP also has a webpage for this.
Awesome. Thanks, Rachel. So I will give a minute if there's any kind of clarifying questions around what Rachel presented, but otherwise I'm wanting to kind of hold discussion once everyone has presented. So let me just ask if there's any clarifying questions about Touchpoints or how it's used. Awesome. Very comprehensive. Thanks, Rachel. All right, so Anna, we'd love to hear about parents as teachers and from the CIS perspective.
Great, thanks for having me. I apologize, I have a bit of a cold today. So hopefully you can all hear me well. Let me just see. Okay, can you all see the full screen there?
We can see the full screen. We are seeing your facilitator, like, so we see the next slide coming up, but
okay,
fine.
Okay. How about that? And if not, we'll just get going. Can you see it now?
No. Oh, yes. Yep, you're good.
Okay. Okay. So thank you for having me. My name is Anna McGuire, and I'm the Children's Integrated Services Coordinator in the Northeast Kingdom. Our region adopted the Parents as Teachers model as part of the Strong Families Vermont Home Visiting Sustained Family Support. We participated in this for a year and continue to use the Parents as Teachers framework in our home visiting work. This is a great order to come right after talking about Touchpoints, because you're going to see how these two evidence-based programs can really dovetail together and complement each other. Just move this here right so I can see my screen. So parents as teachers, again, similar to Touchpoints, is really driven by the family and the goals that family identify. And this is really important in children's integrated services as a whole, as everything we do is based off of family goals and what the family would like to work on. It considers the parent as the expert of their child, putting them in the action seat, right? It helps parents understand their child's behavior through a child development lens. And it gives home visitors information to share with families that is really accessible, right? It's family friendly. It's written in a language in a way that is hopefully takes away some of those overwhelming feelings. So I'm just going to kind of talk about how parents as teachers creates a structure to really look at family systems as a whole. And this includes 3 main parts. So we have the parent-child interaction. Oops, I'm sorry. Let me see if I can go back. There we go. So you have the parent and child interaction, and you'll hear in the words here, right? It's not provider and child. It's really from the very beginning, setting that framework of supporting that relationship and interactions between parent and child. Development-centered parenting. So looking at what the child is doing now, anticipating what skills might come next, and then building on the skills that we're seeing to help that child develop. And then family well-being, right? Kind of coming from a point of all goals going around the child, but recognizing that you know, the importance of the family system, and to support the child, we need to support the whole family. And with that, we're really talking about family well-being, and that's when we start seeing goals outside of just goals related to the child coming into our home visiting practice. So this starts with visit planning, and parents as teachers creates a great, like I said before, structure where there's plenty of planning supports. So there are a set of foundational, they call them, visit notes, where it helps home visitors really look at that whole family approach. And make sure that they're including different elements into their home visit, including that parent-child interaction, the development, and the family well-being. Those are built in to each visit plan, but with that, there's options, right? So there's options of what parent-child interaction to choose, and what development-centered parenting, whether it's talking about routines, or transitions, to really tailor it to the family. I'm looking at my timer, and so I'm gonna hurry along here. So those parent-child interactions from the first visit, the home visitor will explain their role in supporting the parents, right? So that they're there to help those interactions. We know for some families this might be natural, but it doesn't come natural to us all, right? To sit on the floor and play back and forth. And so home visits are really setting that up. One of the first handouts that you would bring to home visit is talking about how both the parent educator, which is the home visitor, and the parent have different responsibilities and what those are, and sharing those responsibilities, really creating a partnership. Play to learn. This is really where we're using materials already in the home. So all the parent-child interactions are meant to build off of what families already have, or things that you could make easily with recyclables. And it's building a practice of parent-child activities. So it's coming in and setting up an activity with the parent and the child, and then coming back the next time and checking in on how did that go? How many times did you do that since we were last together? With family friendly child development, we're really looking at what does learning look like for young children, right? We had a great story shared from our region of a mom recognizing her child opening and closing the fridge door. And she said, you know, it used to drive me crazy, but I understood that they were working on a skill. It was not only gross motor, but they were looking at cause and effect. And when I open it, the light comes on, and when I close it, you know, and seeing that behavior a little as tied to development. So parenting around development, using information on child development to help inform parenting decisions. Also, the ages and stages questionnaire is done on a regular interim basis, so that we can come back to what the child's doing, what skills will come next, as long as as well as looking at milestones, which are really, again, some developmental stages that we would see at certain ages, and it gives the home visitor a list where they can kind of check which milestones the child is doing. And this can be great for parents of noticing, right? Noticing behaviors and noticing growth. And then there's parent handouts around that development. We talked about screening and milestones. And finally, I'm going to end here with just family well-being, right? So looking at the family system as a whole and connecting protective factors to family well-being. And so each time we go, we might focus on a different category. It might be basic needs, it might be education and employment, physical health, and that's really, again, meant to tailor this piece to where the family's at and what they're working on. And that is what I had. Let me stop sharing my screen.
That was awesome, Anna. Thank you. Any clarifying questions about parents as teachers for Anna, or how it's used?
Trying to stop sharing. I might need some help on that.
On the top of your screen, it might say stop share within the Zoom settings.
Oh, I see. It's on my other screen. Sorry about that. There we go. Okay, is it off? There we go.
There you go. Okay.
There you go.
Awesome. All right. So we're going to talk, we will have an opportunity to talk more about PAT, but we are going to move on to Michelle here. Glad you could join us. Michelle, we'd love for you to share a little bit about nurturing parents and strengthening families.
Sorry, let me just get to sharing. Are you able to see
Yeah, looks great.
the screen and not the notes?
Not the notes. You got it.
I did it. So thank you for having me today. I'm Michelle Richling from Prevent Child Abuse Vermont. I'm Director of Family Support Programs, and we'll be talking about the nurturing parenting programs as well as strengthening families programs. So nurturing parenting programs are 12 to 18-week parent education programs, meeting weekly for approximately 1.5 to 2 hours. The length of the program is dependent on which curriculum is being used, and we'll talk a little bit about the different curriculums later. Many of our participants are referred to us by DCF and are already involved with DCF, and many have already lost custody of their kids, unfortunately. Our goal is to try to work with more families who are before they get to that point for the prevention piece. But unfortunately, right now we are working with a lot of families who are already involved with DCF. Nurturing parenting programs foster strong, positive relationships between parents and their children. And this equips parents with practical strategies to manage stress, anger, challenging emotions, and to promote supportive and nurturing environment for their children and families. Most of the parents we work with are facing a multitude of challenges, and were not raised in nurturing environments. There's a lot of reflection that goes into their own childhood and learning new skills to cope with stress and adversity. Sorry, I just have to move this. Oops, move that right out of the way, sorry. So to foster healthy development, we teach effective communication skills, positive discipline strategies, to guide behavior and set clear boundaries to provide a safe environment. As I mentioned, there are many specialized programs within nurturing parenting programs. The ones that we offer mostly are nurturing skills for families, which support families with children from prenatal through age 17. There's a Nurturing Fathers program that focuses on unique fathers' unique parenting challenges, and families in recovery, which is our most requested program at this time. It's unique in that it covers both parenting, education, and focuses on the recovery piece, addressing how substance use affects the whole family and how to support children who have experienced this. Nurturing parenting programs are used globally and can be adapted for diverse needs, translated into a variety of languages, and we offer free translation services to families who need that. Evaluations continually show the program's success in fostering positive parenting and reducing child abuse. We see lower abuse rates among participants and see improved parent-child relationships and emotional connections, resulting in an improved well-being of children. Oh, sorry about that. So overall, the nurturing parenting programs are evidence-based and trauma-informed programs that are proven effective. Studies show a 30% reduction in reported child abuse incidents among families who participate in these programs. Independent assessments demonstrate improvements in children's emotional regulation, social competence, and academic performance, and behavioral issues decreasing by an average of 45%. Also, a significant increase in positive parent-child interactions marked by increased empathy, communication, and conflict resolution skills. This diagrams our results. We do pre and post tests with all participants, and these are the combined results for 2024. We offered 80 programs in 2024 to 727 parents, impacting 1,932 children. So there's 5 constructs that we measure, and you can see those on the left-hand side, and the pre-test and post-test scores, and then the percentage of change. To kind of explain the numbers on here, if you look at the numbers, like high risk for abuse is between 1 and 3, moderate risk for abuse is between 4 and 7, and low risk is between 8 and 10. So you can see how the numbers have changed over time between our pre and post test, which is we're really proud of our results, and see a lot of drastic change. Outcomes I have here, I don't need to read through all of these, you can kind of glance through, but we do work with families to meet their basic needs. It's not part of the program per se, but since going virtually, we offer one-on-one meetings weekly with parents to see if their basic needs are being met, if they need help finding resources to get those needs met, and how we can support them. These would be kind of organic conversations that would happen if we were meeting in person. So because we're meeting virtually, we take the time to reach out. We do surveys so they can fill out the survey quickly if they would rather not raise their hand and say, I need help. And then we reach out and try to meet their needs as best we can. And empathy is a big piece of the programs. Parents becoming more empathetic to their children's needs, which helps support children emotionally. And then there's just a couple more outcomes listed here. And when we talk about the Strengthening Families program next, it goes into a little bit more of the substance use issues and talking with children about those. That the Strengthening Families programs have a strong focus on youth and prevention of substance use. I will stop that before I move on to the next. Do you want me to just jump right into the Strengthening Families? Anybody have questions?
I wonder if, Michelle, you have an example of how, like, what it looks like in use.
What the program looks like in use?
Mm-hmm. Like, it's great to have the framework, but like,
Yeah.
do you have an example of like how you have seen that the program has helped build that connection with parents and their kids?
Yeah, well, mostly the biggest result is a lot of families are asked or required to take this program as part of their reunification plan with their children. So taking this program has resulted in, many families getting custody back of their kids, increasing visitation and things like that. So, they're doing the work. They're reflecting on their own childhoods, and they're, each week is broken down into learning different skills, and practicing those skills and taking those home and practicing them and coming back the next week and talking about how they've tried different strategies and techniques and how that's working, and just kind of a continual building on those skills.
Thanks. Anne had a question about how PCAVT measures abuse rates. If you're able to.
Yeah. That's a broad question. I don't
I think you
measures that.
noted, Michelle, that there was a reduction in abuse rates, and I just wondered how you track that.
Yeah, so the pre and post tests are basically what's tracking that in the when they did a difference between the pre and post tests and showing that their risk for abuse has lessened, based on the assessment that they've taken on all the questions that they've answered in their parenting. It measures their parenting beliefs. So they're asked a bunch of questions about all of the different constructs that are listed, and it measures according to the evaluation what their risk for abuse is.
Okay, thanks.
Yeah. Should I move on?
Yeah, why don't you do that?
Okay.
Thanks.
All right. So Strengthening Families program, similar to the Nurturing Parenting program. It's a 14-week program designed to help at-risk youth through reducing risk factors and improving protective factors. The program's overall goal is to build resilience. There are, so the program is evidence-based, family-focused, early intervention for strengthening families. We're nurturing parenting program are designed for families whose children are at risk for child abuse and neglect. Strengthening Families program is honestly for any family.
Michelle, before
yeah.
you move on, I don't know, you pulled down your screen share at the end of the last talking about nurturing parents. I don't know if you
Am I
are
not
sharing
screen sharing?
screens. Yeah.
Thank
Just want
you.
to pull that up again.
Yep. Oh, I thought I was. Is it not? Is it showing now?
There you go. Yep.
Okay. You can see?
Yep.
Okay. Sorry about that. Thank you for
No
letting me know. I could see. Let's see. So designed for any family is the difference between the two. The goals for strengthening strengthening families program are parents working on skills such as communication, discipline, problem solving. The children work on the skills such as social emotional learning and self-regulation. Families are working on building positive relationships and strengthening their bonds. And as a community, we're working to connect families with resources and services to support and foster their needs. Through using Strengthening Families program, I can't speak today. We are protecting families from risk factors and adversity, nurturing positive relationships and bonds, developing healthy and well-adjusted children, and supporting strong families and strong communities. We are working oftentimes with children who are at risk for child abuse and neglect in our situation, building resilience through strong family support, positive relationships, and positive outcomes. Similarly to the nurturing program, there are different age ranges for strengthening families. There's birth to 5, age 6 to 11, and 12 to 17. Currently, the most popular program for us is the teens, strengthening families for teens, the 12 to 17. That seems to be where parents are really struggling most recently. And the birth to 5, we get requested quite a bit as well. The 6 to 11 is not as popular, and we typically steer people toward the nurturing skills for families, which is, like I said, prenatal through age 17 for that piece. Many of the goals listed here are similar to the nurturing parenting program. However, like I mentioned, there is a focus on reducing substance use in youth through encouraging and teaching parents to talk with their children openly about drug and alcohol use, setting clear boundaries and expectations, and staying attuned to who their children are spending time with and what they're doing, and providing that supervision piece. The overarching program objectives are to prevent child maltreatment and enhance parenting skills and reduce substance use. And then some outcomes, looking at the outcomes, millions of families are served worldwide. We're seeing 20% reduction in child behavior problems, 50% increase in positive parenting practices, and like I had mentioned, we have offered similarly the 80 programs in the past year between the nurturing and the strengthening families programs.
Awesome. Thank you, Michelle. That was a lot of information. Are there any
It was.
clarifying questions for Michelle about the 2 programs? Yeah, Katie.
Just was curious if you could talk a little bit more around the work with the Family Services Division and the required class take, because CIS, Children's Integrated Services, is like a voluntary process, and so you can't require a family to engage with CIS services. So I just was curious if you could talk a little bit more about that relationship and what that looks like for families and
Yeah. So we have, there's a variety of different ways that families can participate. Like I mentioned, you know, sometimes it is part of their DCF, their plan. They are required to do this as part of their reunification plan. There's also, they can be recommended by DCF to do this. It's not required, but it's like, hey, this resource is out here. We think this would really benefit you. And then there's just any family can sign up. You don't have to be, you don't have to be referred, you don't have to be required. You can just, you know, raise your hand and say, I'm feeling like I need some support and would like to take some classes. And we have all of that is encompassed in our groups. We also work with, you know, try to work with parent-child centers. We work with Turning Point and recovery centers that are, you know, working with families who are in recovery to get referrals and just, you know, help spread the word that we offer these programs. We do train facilitators. So it's not always our coordinators that need to facilitate. We can offer training. So if there's somebody who's working with a group of families and they feel like this would be really beneficial and they think that it would be more well received from somebody that they already know and are interacting with regularly, we can train people to offer these programs and give them all of the, you know, curriculum and resources and support to do so. So there's lots of different ways that parents can engage besides just being required.
Thanks, Michelle. Any other
Yeah.
questions? Okay, so we are going to give you a chance to connect with each other in small groups before we come back for a full group discussion. Kate set us up with some small groups. We have 5 different groups to the extent possible that you're able to turn your screen on so that we can have the small group conversation. That would be great. The thing, our kind of guiding questions in those small groups, and we can put those in the chat, is what are the common themes you heard about, and best practices across the approaches? Do these programs, to the extent that you know if these programs are working together, how we are trying to work to kind of break down silos and collaborate to support families? How do we help families find the right programs and navigate the system? And then, you know, what did you hear or what do you know about how these programs are meeting the needs of children and families? And then as we come back together, just really thinking about the system and what programs need to be successful or what as a system we might need to do to better coordinate. So we're going to throw those questions in the chat. Kate did that. And then thanks, Cynthia. It was great to see you this morning. So, and we're going to open the small groups. Will be there for about 10 minutes. They're somewhat random. And so if you don't know each other, please introduce yourself and then we'll come back together a little bit after 10 for discussion. Questions?